Welcome back to another episode of Spilling the Tea with Dr. T.
And Gabriel D.
That's me.
And Lava Lee. The trio is back again. Today, we're going to be diving into a topic we've touched on a little bit in the past, but we want to be a little more specific because the previous time we discussed this topic was a bit more broad. We talked about the pros and cons and a lot of things in between. This time, though, we're going to be discussing the risks involved with rimming.
Cool. Yeah. I'm excited for this one because, like you said, we talked about this before, but we didn't talk about the risks. Are there any risks? We're about to find out very soon.
Well, we did go over the risks in the other video, but this video is specifically about the risks.
Right.
The last video was a little bit long. This one's going to be a little shorter to just let you skim through the risks to make sure you're educated ahead of time before you dive into rimming.
If you haven't watched the other video yet and you want to know more about rimming, please go back a few videos. You'll find out more information about rimming.
Yeah, right? Let's dive into the risks and get started because people are waiting. They're curious. What are these risks?
Can you first remind us, because we don't know, what is rimming?
So rimming involves the use of the mouth and the tongue to stimulate the anus. And of course, this is an activity that can increase pleasure and intimacy between partners, but there are some health considerations you want to take into account before you decide if it's right for you.
Yes.
So historically and culturally, the perception or idea of rimming is definitely going to vary. Some see it as taboo, while others see it as a normal part of their sexual identity and their sexuality. So it's important to know that it can be very normal, but for you, if it's not something normal, there's no pressure. You don't have to add it into your routine. But if it's something that you're interested in, consider giving it a try. But before we do that, let's go over these risks.
Absolutely. And so what are the potential health risks of rimming?
So the main concern we want to consider, of course, is the spread of sexually transmitted infections or diseases. We want to consider all of the options as the majority of them are transmissible through rimming. So things like herpes, syphilis, gonorrhea, chlamydia, HIV, HPV, they can all be transmitted in some capacity. That being said, it is extremely rare to transmit HIV through a rimming activity. HIV does require the spread to be blood-to-blood contact, so there needs to be a cut on the anus and a cut in your mouth at the same time. So there's never been a proven, clinically documented case other than maybe hearsay or a case study where someone says that that was the only activity that they participated in, but never like a clinical trial or some sort of proven fact that it can occur. But hypothetically, it can certainly be an option, so consider protecting yourself from HIV during all sexual encounters. It is also important to note while we're on this topic that if your partner has HIV, but they are undetectable, meaning the viral load in their bloodstream is 0, due to the fact that they're on medication and suppressing the virus, it is impossible for them to spread HIV to you. So that is something to also be aware of. You can also take medication yourself to lower your risk, something like pre-exposure prophylaxis, Truvada, or Descovy are the brand names. Those daily pills will reduce the chance that you would be infected with HIV.
Oh, that's great.
And most commonly, we worry about the bacterial infection spreading through this avenue. So things like chlamydia, gonorrhea, and syphilis can all be spread through rimming. And of course, there's also medication you can take after exposure to a potential person who has chlamydia, gonorrhea, or syphilis called doxypep. So it's actually an antibiotic called doxycycline. You would take 2 tablets within 72 hours of the exposure. And of course, you want to have this prescribed to you by your primary doctor or doctor who knows your history so they can make sure it's an appropriate treatment for you. But again, other ways you can keep yourself safe if you're in that situation or want to try rimming and aren't sure about your partner's sexual history.
Doxypep, another topic that we touch on this video.
Yeah, it was actually our first video.
Yeah, it was our first video. And if you haven't seen yet, please take a look because we give an explanation about what is Doxypep and if you should use Doxypep.
Yeah, we've kind of evolved hopefully a little bit too. So maybe you can see where we started from and where we're at today.
Yeah, it was rough around the edges, but here we are
we're
now.
Still a little rough around the edges.
We're still talking about sex.
Yeah, and that's not always rough.
Well... And are there other infections to consider?
Unfortunately, there are. So there are sexually transmitted infections that can occur through rimming, but beyond that, there are other infections that can happen due to the bacteria that's present in the fecal area. And so anytime there is fecal and contamination nearby an organ or skin, of course, there's the risk that that could contain bacteria, which could then spread to someone else. So things like E. coli, Shigella, Salmonella are all what we call oral fecal route bacteria that can spread from fecal contamination getting into the mouth. And of course, those cause gastrointestinal issues and can be very severe. So you want to make sure that you prepare yourself and prepare the person that you're with by just rinsing off with soap and water. That area can dramatically reduce the risk
Wow.
of that spread. Of course, you may even want to ask them, hey, have you had any recent upset stomach before
Mm-hmm.
this? Or just trying to figure out if they're feeling okay.
Right.
That can make a huge difference to reduce your risk of contamination with these bacteria.
So basic hygiene is fundamental before rimming.
Exactly. So, of course, you want to shower off.
Right.
You want to make sure you haven't had a bowel movement recently. You want to make sure you're not about to have a bowel movement.
Right.
And then oral health, too. There's some controversy on whether or not you want to brush your teeth
Mm-hmm.
or floss before an activity like that because it can open up a cut
Mm,
or cause there to be openings between the gums. And so be a little cautious with
right.
that. You don't want to necessarily go ham on your teeth before
Right.
participating in this activity. But yes, basic hygiene is going to be important before proceeding.
Are there other hygiene tips that you can take?
Yes, so you can consider anal douching, which we talk about on another video, I think multiple videos at this point.
Yes.
So you can consider looking at those if you want more information on that as an option to help further clean the area. If that's something you're interested in, it's not mandatory, as I've mentioned in that video.
Right.
But yeah, there are different things you can try depending on who you are and what you're comfortable with.
Can viruses spread through rimming?
Yes, so you do want to be considerate about the fact that viruses can spread through rimming. The sexually transmitted infection viruses you want to worry about, of course, are HPV, HSV, which would be herpes, as well as HIV, which we talked about previously, and then gastrointestinal viruses like hepatitis or any sort of viral bug like coronavirus, not COVID. They actually used to be more dictated towards a diarrheal type of
Wow.
virus. Yeah, so actually, just a side note, on cruises, coronavirus used to actually be the biggest culprit for causing people to get sick
That's
there
crazy.
gastrointestinally. And so COVID is a different type of coronavirus, but we'll move beyond that and focus on the fact that coronaviruses in general can cause diarrhea. So all of those things can spread fecal to oral route. When thinking of the sexually transmitted infections, specifically HPV and HSV, these are going to be more related to skin-on-skin contact. So the fact that the herpes virus or the human papillomavirus is in the skin while you're rimming, that can be transmitted to you in comparison to the fecal oral viruses, like again, coronavirus or rotavirus. Other gastrointestinal viruses are coming from fecal to oral route. So a little bit different in the way that they're spread. An example being hygiene can dramatically reduce the risk of you
Wow.
developing hepatitis through rimming or coronavirus or rotavirus. In comparison, hygiene is not going to help very much in regards to HSV or HPV. So those are going to be the tips that you want to consider a little bit differently. When you have HSV as a concern, herpes, you want to look for a lesion. If a lesion is present or if there's any sort of redness or irritation, this could be a sign that the virus is actively shedding at its highest peak. And so you want to avoid rimming until that is completely healed. You can also have your partner who may have herpes take a medication called Valtrex or valacyclovir. That dramatically reduces the risk of them having an outbreak and them spreading the infection. Then you consider HPV. If you yourself have not had Gardasil, which is the HPV vaccine, I highly recommend going to a nearby pharmacy. Your insurance will likely cover it. It is a 3-injection series, and you can have the vaccine up to age 45. So I would recommend having that done because it's dramatically going to reduce the risk that HPV can be spread to you. Unfortunately, HPV is invisible. You don't see any lesion or any
Wow.
sign of it on your partner. And what it can cause is oral and throat cancer. So you do want to reduce your risk there for contracting HPV if possible. And Gardasil is very effective of doing that.
Oh, that's great.
While talking about vaccination, you can also be vaccinated against hepatitis A and hepatitis B, both of which can be transmitted fecal to oral route. Hepatitis C, there's no vaccine, but also something that you may want to talk to your partner about if they've been screened for. Of course, we're talking a lot about the things you can do medically in regards to prevention,
Yes.
using vaccines and medications, but you can also just get screened. You can go to your nearby health clinic,
Get tested.
have an STD test done to make sure you're at even further lower risk of developing any of these infections through rimming.
I feel like it's important to point out that rimming is safe, but it's necessary to take the precautions before any sexual activity.
Absolutely. You owe it to yourself and to your partner to make sure that you're feeling your best, they're feeling your best before proceeding with this activity. But like you mentioned, it's safe if done appropriately and can be a lot of fun and something you can add into your sexual repertoire for a rendezvous.
Oh, we're speaking French now.
I mean,
Oui. So I heard that parasites can spread through this activity. Is it true?
yeah, so there are some parasites specifically you want to be worried about. One is called Giardia. It's probably the most commonly transmitted parasite in this activity. It's actually typically found when you're hiking and you drink from a stream and you haven't cleaned that water. It's a very difficult parasite to get rid of, unfortunately, because it attaches itself to your intestine and causes extreme foul-smelling diarrhea. So you will typically know you have it. It's not something that's going
Mm-hmm.
undetected. You just take antibiotics in regards to getting rid of it now. We live in the 21st
Right.
century and we have these tools, but in the past, very difficult to get rid of, and people would actually die from
Oh
it
my God.
because you lose so much fluid from dehydration after the diarrhea. I'm really trying to scare you here, but that's really not my goal. I
Right.
just have the knowledge from school and my own research that Giardia has had such a long history with affecting people. But it's actually very uncommon. You typically would not get this in today's society, but it's still possible, and there are reports that rimming can cause it.
But there's medicine, so there's treatment, there's solution.
Yep.
You're not alone.
Exactly. You take one tablet of this medicine twice a day for 7 days and you're good to go. So, not too difficult.
So it sounds like rimming is a bad idea.
It really does, doesn't it? So, this talk is not meant to scare anyone. It's just to provide you all the necessary information so you can make the best choice for yourself. There are many people who would attest that rimming is a very fun activity to do with a partner that you love or that you trust or that you know. You just maybe don't want to do it with someone that you don't know or someone that you don't trust because
Right.
there are risks. That being said, there are things you can do to protect yourself that's beyond this conversation. That's in our last video that we talked about. So check it out if you're still concerned or want more information about rimming. But in general, it's very safe. You just need to take those basic precautions.
Right. As in any other sexual activity.
Right. Any sexual activity, you need to take the appropriate precautions to make sure you're going to be healthy, safe, and you get the expected result that you're looking for.
Yeah. And can you provide a quick overview of how to best protect yourself before rimming?
Absolutely. So number one, you want to make sure you've recently been tested for STDs and make sure that you're up to date on all the vaccinations that your doctor would recommend for you, explaining to them about the activities that you partake in. So maybe consider Gardasil, the HPV vaccine, hepatitis A and B are great vaccinations as well. If you consider yourself to be at risk of developing HIV, you can consider PrEP as well as a daily medication to reduce that risk. Then you want to talk to your partner. You want to talk to them about your sexual history. Nothing too deep. You don't have to go into details, just about your recent health screenings. Ask them about theirs, explain to them what you're interested in, what you're not interested in, so that they have an understanding of what this encounter is going to look like. Then you want to, of course, make sure you're both ready. So making sure you followed some hygiene, basic cleaning with soap and water in the area. And of course, you both want to make sure that you're ready in the sense of hygiene, washing with soap and water. You can consider douching if that's something that you're interested in. And then as the activity is starting, you can also consider something called a dental dam, which would be a thin piece of typically some type of protective latex that you can apply to the area. This again is maybe a little bit more for someone who is at a higher risk or concerned of the risk, more anxiety around the activity that can help them. You want to also inspect the area, make sure there's no lesions, make sure you are not having any lesions in your mouth as well, because you don't want to increase the risk that things could spread from there. And then as you're getting started, you want to make sure you're continuing to communicate with your partner so that they're enjoying it. Afterwards, if you are concerned about the risk, you can consider something called doxypep, which is that antibiotic that you can take post-exposure to reduce your risk of developing syphilis, gonorrhea, or chlamydia. This is something you want to talk to your doctor about as well to make sure it's appropriate for you. And then once you're done, you both can discuss the activity, talk about what you liked, what you didn't like, prepare for next time, and have a little bonding, because that's really what the whole activity is meant to do, is to help you be intimate with your partner and bond.
I love that. It seems very easy when you say it. Get tested, vaccinated if you need it. Hygiene is important. Communicate with your partner. And doxypep if you're looking to get even more protected.
Exactly. You listened very well. A+ for my student here.
Well, we'll talk about this a few times.
Yeah, so you can again see previous videos if you want more information about rimming. But if you have other questions, you can always leave them in the comments below. We love to read your questions. We love to be able to answer those for you. And that's really what all these videos come from, is the viewers.
Yes, and if you haven't subscribed to the channel yet, please subscribe, like the video if you want, share, post, comment. If you have a story to share with us, we love to hear from you. And
we will see you next week at another video, probably something about sex. So until then, see you later.
See you. Bye. Right, as in any other sex activity.